Here in Kenya, it's not very easy to be MSM.
We are so stigmatized.
It was terrible. I couldn't even go to a hospital. How was I supposed to explain what happened?
The moment you come out, perhaps you be killed.
There's so many diseases coming up, and I'd like my people to be safe. Most of the general clinics are not friendly towards gay people.
And when you go there, they start asking so many questions that you won't feel comfortable answering, and they'll chase you away.
Hence, it will be hard for you to access information about what is affecting you.
I'm a driver, I'm a tracker. I usually commute between Mwanza, Tanzania to Mombasa, Kenya. We are quite busy, so it's difficult to access any facility to be tested or to get information about HIV/AIDS or other any ailments. I've stayed for about 3 years without being tested.
At that time, I was still new in the business. The negotiations were high, so I agreed. When I told him I want my money, that's when the Vita started, beat me up. You know, it's embarrassing. But you know, I didn't know what to do. I didn't have any other alternative. The next day, I had to go back with the bruises still on my face.
Rafiki yangu tulikuwa tunaenda hiyo kasi ya ukahaba. Sasa yeye ndiye aliniambia kuja nikuonyeshe pale lingine. Ndio tuende tufanye nini? Tusome.
With the assistance of NPI, NOPA established drop-in service centers, also called SASA centers, serving the key populations with health education and services, as well as training and support aimed at empowerment, gender-based violence prevention, and provision of alternative sources of income.
We have 9 drop-in service centers in 3 regions, and they are located in high transmission areas.
Alongside implementation funding, NOPA received technical assistance from the TA-NPI team to help strengthen staff skills and organizational systems.
For us to work effectively, we have to have very solid guidelines and curricula. TA-NPI has been a very responsive partner. A partner who then you share the goals of what you want to achieve. They knew we had some strengths in areas and also areas of improvement. They conducted the technical capacity assessment, which identified areas that we just needed to consolidate, strengthen, and ensure all staff members, adhere to those standards. But they also identified areas that needed, some support. A particular area, for example, was curriculum development and training for most at-risk population, in particular men who have sex with men. NPI brought in a consultant to work with us intensively.
We realized that we needed to base our curriculum with the foundation of a socio-ecological model, which tries to look at the individual with the society, the surrounding environment, and looking at the issues that are affecting these particular individuals from either adopting positive behavior, either influenced individually or influenced by the surrounding and even the policies that exist. Throughout this process, TNPI has been supportive in also having trainings with the selected MSMs and also doing a training of trainers for peer educators for MSMs, which initially we didn't have even nationally.
And today I can say proudly, like in Kenya, we have, I would say, the most skilled trainers for men who have sex with men. Those are areas which TNPI has helped.
Having these centers for MSM, sex workers and trackers has been a great achievement for this project.
I got tested first in SASA Center. That was my first ever encounter when it comes to STI screening and HIV test. After that, I made sure that my peers know about SASA Center, and I'm spreading the good word.
The more I see people accessing these services, the more I see people coming out and being comfortable with themselves.
You feel comfortable when you come here, you call your peers, you share a lot when it comes to your health issues and so many things, and thus making it as in a safer place to be. They're the best thing that has ever happened to MSM community in Kenya.
When we meet these people, the SASA people by the roadside, and they convince us to be tested, it's good because it saves our time. I'm very happy because at least I've known my status.
Niliingia hapa ndio ikanielimisha, nikajua kazi sio hiyo peke yake, naweza tegemea kazi ya mikono yangu. Sasa saa hii nausanga hapa uji na napiga chips.
Right now, I know my rights and I know what to do if somebody should assault me. And I know somebody else cares for me. So I'm not alone.